Bismillahir Rahmanir Rahim. This is the first lecture of benign breast disease. Benign breast disease makes you more prone to getting breast lumps. Findings: a lump can be scary, but these breast changes are benign, not cancer. Certain types of breast disease increase your risk of breast cancer. For example, intraductal papilloma in the breast. We are seeing here many types of benign breast disease: fibroadenoma, cyst, abscess, fibrocystic disease. You should notify your healthcare provider about any breast lumps or changes. Most non-cancerous lumps go away without treatment. The question now: what is benign breast disease? If you feel a lump in your breast, your first thought may be that you have breast cancer. Fortunately, a majority of breast lumps are benign, meaning they are not cancerous. Both women and men can develop benign breast lumps, non-cancerous. This condition is known as benign breast disease. While these breast changes aren't cancerous or life-threatening, they may increase your risk of developing breast cancer later on. The question now: how common is benign breast disease? Benign breast lumps in women are common. Up to half of all women will experience fibrocystic changes that cause non-cancerous breast lumps at some point in their lives. Fluctuating hormone levels often cause these breast tissue changes. We are seeing here case of fibrocystic changes in the breast. The question now: how might get benign breast disease? Benign breast disease affects all genders. Men can develop enlarged swollen breasts with lumps, a condition called gynecomastia. We are seeing here gynecomastia. This is before correction, and this is 2 days after correction. Your risk for benign breast disease increases if you have a family history of breast cancer or benign breast disease, use hormone replacement therapy, have a hormonal imbalance. The question now: what are the types of benign breast disease? There are many different types of benign breast disease. Most of the following types don't increase cancer risk and don't require treatment. In this slide, we are seeing here many types of benign breast tumors: fibroadenoma, intraductal papilloma, benign phyllodes tumor, lacting adenoma, myoepithelioma, hematoma, hemangioma, hemangioperitocytoma, lipoma, granular cell tumor, benign stromal spindle cell tumors. In this slide, we are many types of benign breast disease: papilloma, ductal hyperplasia, sclerosing adenosis, fibrocystic fibroadenoma. The first type of benign breast disease is breast cystis. Up to a quarter of breast lumps are fluid-filled cystis. A breast cystis can be tender and lumpy, but they don't make you more prone to cancer. Cysts often go away without treatment. We are seeing here case of fluid-filled cyst. In this slide, we are seeing here many types of cysts in the breast: atopical cyst, fibrous cyst, fat cyst, solitary cyst, multicircular cyst. The second type of benign breast disease is fibroadenomas. These are the most common non-cancerous solid breast tumors found in women aged between 15 to 35 years. Fibroadenomas don't increase cancer risk and often go away on their own. The third type of benign breast disease is fibrocystic breast changes. Fluctuating hormone levels can make breasts feel lumpy, dense, and tender, especially right before menstruation. Women aged between 30 to 50 years are most likely to experience fibrocystic breast changes, which go away without treatment. The fourth type of benign breast disease is hyperplasia. This condition occurs from an overgrowth of cells that line mammary ducts or gland. A condition called usual hyperplasia doesn't require treatment. This is case of atopical ductal hyperplasia. Hyperplasia: if you have atopical hyperplasia, your healthcare provider may recommend surgically removing affected breast tissue because the condition may make you more prone to breast cancer. This is case of atopical ductal hyperplasia. The fifth type of benign breast disease is mastitis. This is an inflammation of the breast tissue caused by blocked milk ducts or bacteria in the breast. It commonly affects women who are breastfeeding, but it can occur in women who aren't breastfeeding. This is mastitis. Mastitis, the inflammation leads to breast pain, swelling, warmth, and redness. Mastitis is treated using antibiotics and pain relievers, for example, ibuprofen. Mastitis does not increase your risk of developing breast cancer. This is mastitis. The sixth type of benign breast disease is breast abscess. Breast abscess is a painful collection of pus that forms in the breast. Most abscesses develop just under the skin and are caused by a bacterial infection. Breast abscesses commonly happen as a complication of mastitis. Treatment with antibiotics and draining the area of pus. In the end of this lecture, thank you for all.